Imagine a child running from that end towards you to give you a big hug. But all of a sudden, you see his expressions changing. He's gone pale. He's not able to move any further. He's clasping his chest. He's not able to breathe properly. And he's in absolute pain because he can't take in a breath, or neither can he actually release it outside. And you as a parent, you're also in pain because you can't actually do anything to help him. All you can do is wait for an inhaler to sort of work out and help him breathe again. So even though asthma is a really complex disease, and there's many reasons why we get asthma, one of the most common factors that we see in asthmatic patients is that they have severe lung damage, and that makes them more susceptible to asthmatic episodes. So most of the reason, it's one of the overlooked factors behind is that most of the asthmatic patients as a child have undergone some kind of an infection in their childhood, which is why they end up getting asthma later on. So the respiratory syncytial virus, or RSV, is one of the agents that's known to cause severe pneumonia in infants and in children less than 5 years of age. And as of now, there's no proper drug to kill off the virus. And if you do end up having an infection at such a young age, the hospitals are basically just trying to treat the symptoms. So this puts you at a higher risk to develop asthma. What we are looking into is actually developing a series of drugs that are highly effective against the virus. And we have actually come across a few chemicals called SINES, or SINES, which have immense promise as a proper drug against RSV. The way that they're designed is in such a way that they'll actually kill off the virus without causing any side effects. So if you treat a child that's suffering from RSV infection with this drug, the drug will stop the virus from completing its replication, so there's no more new virus being formed. This minimizes and reduces the lung damage that it causes, and in a normal cell it actually doesn't do anything at all, so that spares any side effects that could possibly happen. So this makes it perfect for the treatment of any premature infants that were infected with RSV, all children under the age of 5. So we're really close to developing this drug against RSV and possibly slowing down the number of asthmatic patients, at least virus-induced asthma. Thank you.